Hello, my name is Lisa Martin. I'm the manager of Disability Connect, an Auckland Disability Information Advisory Service. I'm also mum to a 21-year-old young man with autism, intellectual disability and epilepsy. I've worked in the disability sector for 7 years, including considerable work with the culturally and linguistically diverse communities. The Korean Community Wellness Society has collaborated with Disability Connect, Waitemata District Health Board and the Northern Regional Alliance on this project to bring you relevant, up-to-date and useful information on the disability sector. The information is specifically relevant to Auckland, and many components of it are also relevant throughout New Zealand. We have kept the video clips brief and to the point. The topics follow an age-related and progressive format, so you can watch each individually or all together for an overall picture. You can always access more detailed information from Disability Connect and a range of other disability information providers. Come, let's talk further. Before we proceed any further, it's important to know that New Zealand adheres to 3 guiding doctrines in the disability sector. The New Zealand Disability Strategy, which is currently being reviewed, the United Nations Convention on the Rights of the Child, and the United Nations Convention on the Rights of Persons with a Disability. We also have a Health and Disability Commissioner, which oversees the rights of individuals in the health and disability sectors. The HDC promotes and helps ensure organisations and health professionals adhere to the Code of Rights. This Code of Rights includes being treated with respect, freedom from discrimination and harassment, the right to be fully informed, access to services of an appropriate standard, access to support, the right to complain, and several other important rights. More information about this important Code of Rights in New Zealand can be obtained at this website. Now let's talk about diagnosis. In New Zealand, disability is typically diagnosed by a paediatrician or a developmental paediatrician. Some disabilities are apparent shortly before or after birth. They are called congenital disabilities, such as Down syndrome, cerebral palsy or spina bifida. In this case, the maternity hospital staff will put you in contact early with the relevant support agency for that particular condition, so that you have assistance to gradually come to terms with the diagnosis. Some disabilities become apparent over time, when your young child's developmental milestones are not achieved or are delayed. These are called developmental disabilities. For example, sometimes a child who has an array of missed or delayed developmental milestones, such as delayed speech, lack of eye contact, lack of imitating skills, or obsessive behaviour, might potentially be diagnosed with autism spectrum disorder. In developmental disabilities, it is common for parents to first approach their general practitioner, or GP, to discuss their concerns, and the GP may then refer to a paediatrician. Paediatricians have expertise in extensive testing for developmental conditions, or conditions which become apparent in early childhood, such as autism spectrum disorder, dyslexia, dyspraxia, attention deficit hyperactivity disorder, and many others. The ASD Coordinator Service is accessed via the District Health Board. These professionals help coordinate the referral and assessment of children with autism spectrum disorder and can give advice on the management of autism in children and youth. There are many different disabilities which might affect a child. Sometimes a child may have more than one disability or a combination of physical, intellectual, sensory disabilities. In New Zealand, there are disability-specific organisations such as the Cerebral Palsy Society, the the Down Syndrome Association, or Autism New Zealand, who are there to inform and support and provide various programs and support groups. There are also general disability information providers, such as Disability Connect, which can offer advice and support on a wide range of issues related to disability. These types of organisations are called NGO, or non-government organisations. It's important that families feel supported and guided towards information which will help them to navigate the disability sector and seek the next level of assistance. Now let's talk about the Needs Assessment Service Coordination process, or the NASC. Commonly upon diagnosis, the paediatrician or the general practitioner will refer the family to the NASC. The NASC will assess the family's needs. There are 15 different NASC provider locations throughout New Zealand. In Auckland, the NASC is called Taikura Trust. Their role is to assess the disabled person's needs and allocate Ministry of Health funded supports. The Ministry of Health in New Zealand funds a range of supports, and they are assessed based on the level and type of need. Families can self-refer to Taikura Trust. Their website and referral forms are available at this website. Taikura Trust adhere to the Ministry of Health definition of disability when assessing your eligibility. The definition is people who have a physical, intellectual or a sensory disability or a combination of these which is likely to continue for at least 6 months and limits their ability to function independently to the extent that ongoing support is required. Taikura Trust will acknowledge your referral and check your eligibility to receive New Zealand Ministry of Health funded supports, and if eligible will arrange to visit your family for a full needs assessment. This assessment can take up to 2 hours and covers a wide range of questions on certain domains of ability and safety. For example, there will be questions on your child's ability to toilet themselves, showering and other personal care skills. Also, questions to explore the child's general awareness of safety, such as running away or crossing the road, the need for supervision, the need for family carers to get a break, etc. It's important to tell the assessor everything you feel so that they can paint a full picture of how your child's disability affects them in family life. From this assessment, Taikura will decide a level and type of support best suited to your needs. Sometimes a support worker can be arranged to come into the home to shower your child or to supervise them and to give you a break. This is called a support package. A support package might include such supports as, for example, personal cares or respite. Together, some supports can be transferred into a funding mechanism referred to as individualised funding. For more information on individualised funding and the flexibility this can offer you, please contact Disability Connect. Every 3 years, Taikura Trust need to do another assessment to ascertain if needs have changed. In the interim year, sometimes a telephone review might be quicker and shorter to review and ensure that the supports provided are still meeting the needs of your family. The types of supports that Taikura Trust allocate do not cost families money. These supports are funded by the government, the Ministry of Health. They may also provide information on other service providers who do charge for their services. The Ministry of Health also funds equipment and modification service. This can be accessed via an occupational therapy assessment. You can ask Taikura for more information about this process. Under this type of support, EMS or Equipment and Modification Service, a person with a physical disability who has difficulty accessing everyday activities can apply for a piece of equipment or a housing or a vehicle modification to assist them with daily living. An assessment is performed by an occupational therapist to assess the best type of equipment or modification for your needs.